you don't find any bone coming out of your body. But if you see a bony fragment projecting out of a wound, for sure you can tell the patient has what? A fracture. Next is what? Pathological mobility. Yeah, that means what of bone is going to move. If you touch the palpate the affected limb and try to move, yeah, it is going to move. So in that condition, we write it is called as pathological mobility. When the bony fragment is going to move, you're going to hear a sound, and we call it as crepitation. Yeah, so we hear a word. We'll be hearing the word crepitation. Yeah, we'll hear crepitus. Yeah. Next, of course, when we take that limb, the limb is going to look deformed. Why deformation happened? Because the bone get displaced. Yeah. Then, of course, the length of the limb is going to be shortened. So, first sign, appearance of bony fragment. Second sign, pathological mobility. Third sign, crepitus, deformation, and what happened? Shortening. These are the 5 specific signs of fracture. So this one you should know it as a golden rule. You should memorize this thing. Yeah, actually not memorize. Let's try to be very logic. Yeah, see, patient came with a fracture. Yeah, patient will complain of pain. Where he complain? Patient came to hospital for an example, pain in the forearm. Yeah, you look, what you'll be seeing. You see bruise and swelling in the region. Yeah, you touch the region. Maybe there is increase of local temperature, lesion of function. This is general sign. Specific sign. You look at the skin, there is no damage. Yeah, first sign is absent. Second sign, if you try to hold both the hand and try to move, if you can move, yeah, there is pathological mobility present. Yeah, of course, when there is pathological mobility present, you can hear what? Crepitus. Yeah, of course, the limb is going to get deformed, and then length of the forearm is going to be shortened. So these are all what? Specific signs. Understood, doctors? Hello? Hello? Here we understood.
Yes, understood.
So this is what is being explained over here already. Yeah? So appearance of bony fragment. Yeah? This is only present in case of what? In case of a open fracture. In closed fracture, the sign is absent. Next, pathological mobility. I told you how to check. Yeah, you put your hand proximally distal to the fragment, try to move. If you can move the limb, normally there is no movement in the arm. If you are going to move, then it is positive. This manipulation is very painful. Yeah, so you carry it with care. Yeah. Next, you will be hearing crepitus. Yeah, you see deformity in bracket. We can write displacement. Yeah, displacement. Can you put your hands? Everybody, can you all put your hands together? Can you put your hands like how I'm putting? Yeah, you see. I will teach you one more exercise, and we'll finish our class today. Let us all put our hands together. Hello. See, imagine my hand. Yeah, so like this, not like this. Yeah, I put like that. Yeah, so after fracture, yeah, here the fracture happened. In between them, the fracture happened. How the bones can get displaced? Bones get displaced by width, bone get displaced by length, bone get displaced by angle and rotation. These are all types of displacement. Yeah, by width, by length, by angle, and by rotation. This is very important, because next lecture we'll talk about how to treat the patient. Yeah, because treatment is not like this. I have to bring the back extremity, not like that. First of all, I should restore the rotation, then I will restore the angle, I'll do traction and put back, so that the bone should be back like how it was before. Understood, doctor? So types of displacement. So when we have when the bone get displaced, so we have deformation. Understood? Understood?
Yes, sir.
So this puts a question: why the patient has displacement? Why the patient had displacement of fracture? What causes displacement of these fragments? Why? What is the reason? There are 2 reasons. Who had with some people? I had a class one day. I told them. So what are the 2 reasons for displacement? Who can tell me? Why bones get displaced? Anyone?
Some rupture of ligaments and
No.
no.
It's not because of rupture of ligaments. That means in all the fracture there should be a rupture of some ligaments there, but no, yeah, it doesn't happen every time. What causes displacement of bony fragment?
Can it be by muscle action, sir?
Okay, this is the second sign. Yeah. Concretely, what happened? Pull of muscle. Yeah? This is the second answer. Yeah, because of the pull of muscle, yeah, you have what? Displacement of fracture. Very good. This is second sign, but first sign, first reason.
Due to the force from
Very good.
the
Yeah. Due to the traumatizing force. Yeah. See, imagine if this is this is my forearm and a big hammer hit me. Of course, the bone is going to open like this. Yeah. The angle of the bone is going to open like this. It's not going to be like this. If I had a hit, yeah, the bones are going to go down. Both the bones are going to down already. Yeah. First reason for displacement is what? The traumatizing force itself. After the traumatizing force disappear, because of contraction of muscle, yeah, you have deformation secondarily. Yeah. So is it important to find deformation or not, or no? Is it important to analyze deformation present or not, or no need?
it's important
Why?
because we need to put the bone in the normal axis, otherwise the person can have problems with mobility afterwards.
Yeah, very good. Very close to what I'm expecting. Yeah, so very good. Yeah, because if patient is deformed, we have to bring it back to normal. Yeah, or else what happened? His girlfriend or boyfriend will tell you, your leg is not beautiful anymore. I'll divorce you. Yeah, I'll run away from you. Maybe. Yeah, this can be one reason. Another reason is what happened? Quality of patient's life is going to be affected because one limb will be shorter than the other limb. Yeah, of course, it's not going to be good when if it is going to be in the lower limb. Yeah, of course, deformation is very bad because when bones get displaced, what can get trapped in between the bony fragment? In between this bony fragment, what can get? An artery can get trapped. Yeah, maybe a nerve can get trapped. Yeah, in between this region, and what happens? It can cause what? Different degrees of what? Complications. Understand, doctor? So deformation by itself is very bad. Understood? Understood.
Yes, sir.
So here we have a picture that talks about line of fractures. So this one can be seen only in X-ray. Fracture can be transverse, fracture can be oblique, fracture can be spiral, or it can be comminuted. In vertebra, we might have compression fracture. Yeah. In children's, we have a green stick fracture. Green stick fracture. Understand, doctor? In children, we have green stick fracture. You see how to analyze an X-ray film. First of all, you should know what part of the bone. Yeah, what bone is it? Is it a femoral bone, or is it radius and ulnar bone, or it's the humerus bone? Yeah, first know the name of the bone. Yeah, here it is a humerus bone. Yeah, then try to look at the bone. You see here we see a fragment, so it is a comminuted, yeah, fracture. Yeah, localization where it is, we have just not discussed. I told you the long bone here, diaphysis. Yeah, especially here it is the middle third diaphysis of the humerus. Yeah. And when we, in relationship to the bony fragment, of course, it is got displaced. So how to write diagnosis for X-ray? It is a comminuted fracture of middle third diaphysis of whatever humerus, yeah, with displacement. Understood, doctors? Hello? Understood.
Yes, doctor.
Yes, sir.
So I will stop here. Yeah, if I continue more, you will get more confused already. So I will stop here. Next lecture will continue with our this topic. Yeah, see, this lecture is available.